you would have received a list of consent forms, and in that folder, the first, which is zero space list, is the list that I am going to explain. Now, this list, if you open, the first one is the admission form. Now, once when you decide that this patient can be treated or admitted in the hospital, you need to fill in this form. The consent of admission also has to be taken. After the patient is admitted, the doctor has to do the initial medical assessment. The medical assessment has to be done by allopathic doctor, especially in allopathic hospital. It cannot be done by any other pathy doctor. In case if the treating doctor is not available, it can be done by any other doctor who is available in the hospital, and the treating doctor can sign at a later time. Initial nursing assessment, preferably this should be done. In case if you are not too confident about the competency of your nursing staff, you can skip this particular nursing assessment. However, it's a good idea to get this form filled in by your nursing staff. Teach them. It's not very difficult, but if they start filling them, they'll feel included in the whole NABH process, and you can get a good cooperation from them. Treatment sheet. We have given a sample of treatment sheet, but whatever treatment sheet we are using is good enough. Please make sure whatever treatment sheet that you have should have a provision for a date, a time, the treatment or the observations made by the doctor, the prescription. The prescription written should be very legible. Preferably it should have a date. It should be written. Preferably the prescription should be written in a separated words or a capital, and the route also like IV or oral can be given, can be mentioned, and what is the frequency of the medication. The nursing score can be done on the treatment sheet itself by putting the dash, and at the end of the dash the nurse can put her initials. We will come to that at a later date. TPR chart is maintained by the nursing staff. Whosoever is taking TPR, that name of the nurse has to be written down and the time at which it is taken. Nursing over, it's good idea to take this to fill in this format. Nursing over, it's a good idea to fill in this form so that a proper documentation is maintained, and even nurses get into the habit of writing down even the smallest of event that had happened in the hospital when doctor was not available immediately. This is very important and very much helpful for the treating doctor to understand the position of the uh, patient. And at times, even the smallest incidents becomes very crucial, and hence, if this can be filled in, it's a good thing to do. Uh, if you don't have confidence in your nursing staff, please skip this. But for ICU setup, this is absolutely required. Feedback form is completely optional. You may take your own call as to when the feedback plan, whatever format that you want to have. This is completely optional. Home care advice, again, when the patient is discharged, what should we take care, how should he take medication, where the medication should be stored, how to take care of the wound, what if some what happens, then he should immediately contact the doctor, etc. Normally this is done by a RMO or a nursing staff during last few days of the stay. Format for discharge summary, you can make sure that format for discharge summary, make sure that this is completely filled in, and the discharge, whether it is to home or to other hospital or DAMA or death, should be very clearly mentioned in the discharge summary. Also, end of the discharge summary, you should write down as to when and how to seek emergency care. Now, when depends upon the reason of admission, and it can't be generalized printed material. Consent for anesthesia, consent for surgery, definitely to be taken, and the consent form should be signed by the treating doctor, also by the treating the consent form should be signed by the concerned doctor, and whether it is an anesthetist or the surgeon, it needs to be signed. Put time, date, SNDT, that is time, name, dated time, has to be there. Consent for HIV testing is very much required as per law. Normally, in the formats, if you are using the format that we have given you, it's HIV testing is consent is already taken in the admission consent. If you are doing any surgical procedures like bedside procedures like fluoral tapping or any such matter, then you should take the consent for surgical procedure. Pre-op checklist and WHO surgical checklist are self-explanatory, and the WHO surgical checklist has to be signed by the anesthetist, by the surgeon, and by the washed up nurse. Pre-anesthesia evaluation